Hey guys, my name is Lucky Rebel, and I'm here to talk about X-Roll Intral exam. Um, I'm no genius, but these are just little tips that I've got taught from demonstrators, fellow students, older year students, and help me kind of effectively deal with X-Roll Intral exams, and to how to help in creating a differential diagnosis, and then further special tests and effectively treating the patient thereafter. So with external internal exam, usually in cases like this, you'll be presented with just parts of information, and then which you have to piece together to form the external internal exam. With the external exam, you might get something like a patient has no jaundice, no anemia, possibly cyanosis, and then lymph nodes, TMJ, NAD, lymph nodes palpable, sorry, something like that. In an intraoral exam, usually you'll be given some photos, and if it might say at the very bottom, uh, lesion is palpable, presents with pain or something like that. So, but that's usually that doesn't said. So, with extraoral exams, the key here is to start to think of all the possible implications that arise if the patient does have a significant finding, or and also the other key thing is to not go too broad. Although broad is great, you have to remember that as a clinician and dealing with patients, you don't have time to constantly think about everything. You need to think about relevant stuff as well. So they both go to and fro, those two, the implications and kind of keeping it narrow. So you have to be efficient in that. So and it is hard. Trust me, I still haven't figured it out. But at least this will help in giving you an idea of how to do things. So, for example, I'll give you an example. So, say if the patient came in and said, everything else is NAD, but the patient has jaundice. Well, what do we consider with that? Well, jaundice is a bilirubin dysfunction, and we know that bilirubin breakdown occurs in the liver. So already we have to start to consider that maybe there's a dysfunction possibly in the liver. Now, what does that mean? Well, liver dysfunction, well, liver creates clotting factors, which help in clotting, blood clotting. And if we have open wound, such as in a dental extraction, then it'll create the clot, which will help in preventing excess bleeding, preventing further infection, and help in healing of the overall that opens that socket. And so if a patient who has jaundice may possibly have liver dysfunction and may possibly be prone to further infection because they have a liver dysfunction. Um, so that's something you have, and then therefore invasive treatments such as a dental extraction might be contraindicated. So these are the things to have to consider. Um, Also, you might want to consider is that the liver dysfunction could be due to as I said before, liver destruction, but it could be from a bloodborne virus, such as a hepatitis A or, sorry, not hepatitis A, sorry, hepatitis B or C. Hepatitis A, sorry, is not a bloodborne virus, but it is something still to consider that they might have a liver disease. So, and the patient's unaware of it, or they do have it, and like a bloodborne virus, and therefore infection control is really, really important. So again, these are things you just have to consider and think of. Um, Now, other areas could be something like the um, lymph nodes are palpable. Now that means with that one, also implications are important, but we have to also ask further questions as well. Because palpation, they could be soft and tender, or it could be hard and painful. Now both of those bring two different differential diagnoses. Usually soft and tender are from a infection like an influenza, and hard and painful usually come from possibly a malignancy, something more sinister. So we're asking, in the case, asking like, I will ask further questions, such as whether it was painful for the patient or whether it was soft and tender for the patient. Then that can also help in your differential diagnosis. So the other key important part, besides the implement to help you with the implications, sorry, is creating questions. So with the intro exam, the key here is to uh, describe the photo, and then find the significant findings, and from there be able to help and create a differential diagnosis. Now, the reason why we do this method is because the intraoral photo can contain a lot of structures, which can put the clinician onto different parts as they might be focusing on other areas which might not be relevant uh, well, it could be relevant, but not relevant dentally. So that's why it's important to describe the photo and then be able to pick what is significant and insignificant. Um, to describe a photo, there are different methods. This is the Lucky Rebel method, which is kind of modulated um, from the Merck manuals. So if you want to have a much more in depth and a much better one, type in the description of skin lesions Merck manuals in Google, and that has a much more in depth way of how they break it down. But this is the way that I just took more of a summarized view, which will help you be able to do this really quickly, not just in case photos, but even when you're on clinic and you're taking a clinical photograph of a lesion. So first things first, always describe what the photo is. So, for example, the photo that I have up right now, this is this is a irregular shaped this is a right hand side dorsal surface of the tongue as it is protruded out of the patient's mouth. Full stop. That just what the photo is. From there, I start with L, which is location. So describe where the location is. It doesn't have to be complex. Just lesion is at right hand side of the patient's tongue. There. Um, uh, to be more specific, you could add a lateral border of the right hand side of the patient's tongue as well. Next is color. Color is very important as well because color can also help you in creating a differential diagnosis from red or white lesion, or it could also be a discoloration, etc., etc. So, for example, with this one we stated a white lesion. And then for shape, then we go to S, which is shape, which now shape can consist of a lot. You can use a lot of types of adjectives to help describe the lesion. Don't get too complicated because then it's quite difficult to describe to the demonstrator, but also it's difficult to describe to your patient as well because your patient's also going to be hearing these things that you're describing to the demonstrator and not just to the demonstrator. When you're for even for case studies, when you're explaining this to your assessor, they're going to be thinking that wow, you're going to be using these complex terms as well because the patient might get confused. So use something like I usually should say irregular or irregular. So if a lesion is quite spreaded and it's not uniform, I usually just use the word irregular, irregular shape like that. Or you could use something if it's got a certain characteristic. So if it's quite striated, so that means quite thin, uh, thinned out lesion, which got nice um, fine strands. You could use the word striated. If it has it has like a growth on it, it's got multiple growths on it. You could say the words like exophytic or fungotic. I think that's the word. Fungotic. Yeah, so just different words that you can use to help describe the shape of the lesion. Now, once you've done that, you can actually piece all these into the one sentence. Once you've done LCNS, so that could be something like there is an irregular shaped white lesion spreading across the lateral border of the right hand side of the patient's tongue. Full stop. Not everything's summarized. The shape, the location, and the color all in the one sentence. Next, move on to dimensions. So the overall dimensions of for example, it could be like the overall dimension of the lesions appear to be 3 by 4 millimeters. Full stop. It's quite self-explanatory, that one. And next, talking about whether it's elevated or not. And again, you can put those two to a sentence. So again, the overall dimensions of the lesion appear to be 3 by 4 millimeters, and it does not appear elevated. Full stop. The next on the Lucky's list is B for border. So you could say something like it's really simple. Just borders are well circumscribed or borders are irregular. full stop. And again, you can add that to your sentence before with the dimensions and elevation or not, or you can keep that by itself. Really, nothing, not too complicated. And after that one, you can move on to the DDX. So you can say something like, from all these clinical findings, it could possibly be oral candidiasis or leukoplakia, something like that. A special tip, it might be best to use that, to not you as the person who's doing the extra intraoral findings in a case study. It might not be best to say that. It might be best for the person who's doing differential diagnosis as a nice link. That person might be like, Lucky stated, the lesion on the lateral border of the tongue could be blah, yada 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 yada, and we'll do these certain special tests. So, and that can also be a nice way to flow the case presentation as well. So, just to summarize, L for location, C for color, S for shape, D for dimensions, E elevated or not, and B for border. Now, one thing I want to quickly go over is why we do elevated and why we do border. Good questions. Elevated, it's important to know that because lesions that are elevated, they could be due to swelling, it could be due to pus accumulation, it could be due to a underlying, or it could be due to a exophytic growth that could leave it elevated, something like that. So again, these are the things you need to consider. That's why it's important to know whether it's elevated or not. Border is important as well. Border helps in differential diagnoses. Lesions like oral squamous cell carcinoma, usually the borders are not well circumscribed, irregular. Borders that are well circumscribed can be are more localized as well. Something like a wart, for example, or mucocele, whether it's just localized and yeah, something like that. So again, it's important to know how it can help in differential diagnosis as well. So there you have it. That's just a way of how you deal with extraoral, intraoral photos. If you have any questions, please let me know. But I'm sure Dr. Polonavita will definitely help you out. And that's about it. So just remember, the person who is doing this for their case studies, or if you're just doing this by yourself for a case presentation in the future, just remember that to look for the significant findings and use these to help with the differential diagnosis. Now, actually, one quick thing to add, although you might think to go through everything, that would be great and it shows you or assesses or shows your patient that you're really smart, that's awesome. But just remember that you might not have all that time. So that's why always look for the significant findings. My group, we used to put a lot of the findings on a table, really easy table, and then you can just look through the table. And that's really easy, and you just talked about the significant findings. So yeah, that's about it. Hope that helps. Thank you.